A federal judge has temporarily suspended New York's vaccine mandate for healthcare workers who claim religious exemptions. The order comes after 17 Catholic and Baptist medical professionals filed a federal complaint calling the mandate, quote, unconstitutional and unenforceable. Some state leaders have called federal vaccine mandates an overreach and vowed legal action. In New York City, 61% of the population is fully vaccinated. COVID cases and hospitalizations are decreasing as students return to school for in-person classes this week. That is some good news. Dr. Dyan Hes is joining us now. She's the founder of Gramercy Pediatrics in New York City. Good news about the numbers going down. We'll see what happens with the mandate for healthcare workers to get the vaccine. But Dr. Hes, cases are trending down and in-person learning has just begun in New York City. It's early, but this virus has proved to be, a little unpredictable. We've certainly seen in other school districts that cases have popped up. How can parents, teachers, and students proactively prevent the spread of COVID-19 in schools? Or maybe it's not about preventing it necessarily. Maybe it's just about containing it when a positive case does pop up.
Exactly. I think that it's super contagious right now. The Delta is much more contagious than the original strains that were going around. So I think it's just about being a responsible community member. If your child is sick, remotely sick, just keep them home from school. Don't send them to daycare. Don't hire a babysitter to come and take care of them. You have to stay home. I think the hardest part for many, many families is the quarantining. If your child is positive, the parents have to stay home from work. They can't go to work. They bring outside help in. And what I'm finding right now is that for the majority of cases of patients I have, they're usually just testing positive with almost no symptoms, maybe a runny nose or an episode of diarrhea, which really resolves in a day or two, but the family has to stay home for 10 days. And that's really where the problem lies, which I think is a lot of people break quarantine and isolation because they just need to do things and they get a little lazy.
So, doctor, as kids become exposed to COVID-19, some doctors have come forward revealing that adults are not alone in suffering from long-haul COVID. Children are suffering as well. So, as pediatric cases rise, what does the science say about what long-haul COVID could mean for children down the line?
It's too soon to tell. Right now, studies are saying that out of children who have COVID, maybe 6 to 10% of them have long-haul COVID. Now, these are the kids who end up in the hospital and have major complications from COVID. So I am not a hospitalist, so I don't want to comment on patients that I've treated, but I have, we will have to see if these are kids who already had underlying illnesses or these were kids who were completely previously healthy. But listen, this is going to affect them, their lungs, their learning, they're missing school. I mean, we know with long-haul adults, I have many friends who are already on early disability, when they went through the first wave in COVID in New York City. So only time will tell. The more adults get vaccinated and the less children are vaccinated, the only place that COVID is going to have to go is children. They're going to be the vectors. So we're going to see numbers rise. We weren't seeing long-haul COVID last March 2020 because it wasn't in kids as much. But now that it's in kids and the numbers are just increasing exponentially, we're going to see more cases of long haul, and only time will tell. And I think that's the hardest part. We don't have the data for so many questions about COVID. And, parents and, patients do not like when doctors say we don't know, but a lot of things we just don't know.
There's this philosophical argument about us giving up our autonomy when it comes to federal mandates. Leaders in states like Arizona and Texas are calling these federal mandates an overreach of power. We just talked about this case here in New York with Christian medical personnel who feel like there's an overreach. Their concern is about religious freedom because the vaccine was developed to some degree with the use of fetal cells, aborted fetal cell lines, which means we're talking about a cell that was, taken many, many, many generations ago. So it's not sort of a direct thing, but this is a concern to these people. Is there an argument to be said that a vaccine mandate is infringing on our autonomy, on the decisions that we make about our own health care?
I don't agree at all. I feel like we've talked about this. This is public health 101. We have public health laws to keep people safe. So, you might not want to take the vaccine and you're a physician or a nurse. That's your choice. then don't work in healthcare. That's fine. You can stay home. You can do telehealth. You can be find another job that doesn't require the vaccine. But don't be a healthcare worker, and don't be a hypocrite, because I promise you that they are using many other products that probably were derived at some point from some fetal cell line, because most medicines are, and most research works that way. The Pope has said, get the vaccine. There is no, we keep on having these discussions at all these doctor boards. There is no religion that says that you cannot get the COVID vaccine, period. And the fact that New York State is even granting them this court case to be heard and a pause, I think that's a travesty. I think this is feeding into the nonsense that these vaccines are dangerous and that we're taking away autonomy. To come into this country, you have to be vaccinated as a legal immigrant. You have to have MMR, you have to have polio, you have to have DTaP. To attend school, you have to have a minimum requirement of all these vaccines. Nobody's done their research. They listen to their doctors. But now all of a sudden, people like Nicki Minaj are giving advice about whether to get the vaccine or not, and her Twitter is not shut down. So as you can see, I have a lot of anger because the misinformation is leading to many, many unnecessary deaths.
Doctor, it's interesting. I was talking with a friend yesterday afternoon who has a case of breakthrough COVID, and he was not in the hospital. He credits the vaccine for his illness not being terrible. I mean, he was pretty sick for 3 days, he tells me. And he said to me, I wonder if doctors should start calling this not a vaccine, but some kind of a protection. I don't know the medical terms, but I said to him, that's what a vaccine is, right? I mean, you get a flu vaccine and you can still get the flu. It's the same thing with COVID. You get the COVID vaccine, you could still come down with COVID. But I do wonder for people, I think that in the politics of it all, people are pointing to cases of breakthrough COVID or pointing to cases of children getting infected who are older than 12 and have been vaccinated and saying, see, doctor, this is not protection against the vaccine because I'm getting sick. And so while we've vaccinated a lot of people, they're going to use, for example, what we're seeing in Singapore, which has one of the highest vaccination rates in the world. And they did have some of the strictest lockdown measures in the world. And even they are dealing with Delta. So I guess the question for you is for the folks that are watching us, for them to understand that even if we are vaccinated, even if we receive our boosters, that does not mean that we still can't become infected with COVID, just the same way we can be vaccinated against the influenza virus and still come down with the flu. It's not about whether it works or it doesn't work. It does work, but maybe it's not just an end-all, be-all protection.
I don't think there's much more we can say because the word vaccine is the correct word. It's preventing deaths. So some vaccines are more effective than others, right? We can eradicate polio from the planet, but we can't eradicate COVID. And that's something that people have to understand. I think people really still believe that COVID is going to go away. And what most scientists and epidemiologists are saying is that COVID is here to stay and it's going to keep on mutating and we're going to be chasing our tails. The best thing we can do is decrease hospitalizations. I mean, everybody's heard about that case of the man who was turned away from 43 emergency rooms with a heart attack, and then he eventually died from his heart attack because the ICUs in his state were overrun with COVID patients. I personally think this is the worst outcome. This is what we've been preaching about. We need patients to get the vaccine so we can have real sick people who cancer. What about appendicitis? What about a car accident? We need beds. And the states that are vaccinated, like New York, oh my gosh, rates are going down because we've done such an amazing job because we saw the devastation of COVID in March of 2020. And we need these other states to follow. This doesn't need to be a state issue. This needs to be a national issue. And, it's constitutional versus federalist. You could have all these different types of political views, but in the end, we're all one nation, and we have to do what's best for our society is how I feel.
Yeah, I mean, that is just sort of good advice in the sense that we are going to be battling this, virus. And perhaps, look, it may have been lost in the translation. When this all happened, all of us, doctors, people in the media, politicians, didn't know what we were dealing with. So I'm sure there was at some point someone who said, look, when we defeat COVID, our lives will return to normal. And maybe that wasn't the right language to use. Maybe the language to use now is, we're going to be living with this just like we live with a lot of other nasty bugs out there, and finding ways to combat it and to keep each other safe, our neighbors, our friends, our families, our colleagues, is just going to be part of our daily existence, sadly, for the years to come.
But also,
go ahead, Anne-Marie.
Vlad and Dr. Dyan, maybe you can sort of clarify this, but you talk about the polio, being able to wipe out polio. I would suspect that part of the reason that we were able to do that is because of widespread vaccination. It's because everyone got on board at the same time and got vaccinated. And part of the reason that COVID is such a challenge, and I'm sure this virus in and of itself is quite confounding, but it's also the fact that, we've been really slow to get everyone vaccinated in this country and beyond, and so we're giving this virus time to mutate.
Exactly. It's too much information, and everybody is a specialist. I saw a meme going around on Facebook. I don't know if you saw it with if you can answer these 6 questions and you're a specialist, and it was all immunology questions. What is a mast cell? What is a CD4 receptor? But everybody all of a sudden doesn't trust science and doesn't trust the physicians and doesn't trust their president. And it's all these conspiracy theories, and that's a lot of the social media. That's the
Yeah, I did send that meme to Anne-Marie yesterday because I couldn't answer even the first question. These are for the folks who say that they're doing their own research. Would have loved to have be a fly on the wall in their 10th grade biology classes to see how much that research and knowledge that they had back in 10th grade still works today. Dr. Hes, as always, great to talk to you. Appreciate it.